All right, so I am very excited to chat with Dr. Nirala Jacobi about SIBO, as I've been following her on our podcast for a number of years. And previously, I interviewed Shivan Sarna as we covered some of the basics of SIBO, including the symptoms, causes. We spoke about the low FODMAP diet, prokinetics. And so here we're going to go in a little different direction. But first, I wanted to share Dr. Jacobi's impressive bio. So, Dr. Nirala Jacobi is a naturopathic doctor and internationally recognized expert on small intestinal bacterial overgrowth. She is the creator of the SIBO Bi-Phasic diet, a resource that has helped tens of thousands of SIBO sufferers around the world. And Dr. Jacobi is the host of the SIBO Doctor podcast and the founder of the SIBO Doctor, which is an online educational platform that includes a practitioner certification program. She is also the medical director of SIBO Test, providing innovative testing options for SIBO and IBS. And Dr. Jacobi is known for her systematic and effective approach to diagnosing and treating SIBO and other functional digestive disorders. Having received her naturopathic doctorate in 1998 from the esteemed Bastyr University in Seattle, she brings more than 2 decades of clinical experience and expertise to her clinic, the Biome Clinic. And thank you so much for joining us, Dr. Jacobi.
It's a pleasure to be here. Thanks for the invite.
Yeah, you are very welcome. And I like to, start off, Nirala, by just chatting and getting a little bit of your background. How did you start focusing on small intestinal bacterial overgrowth?
Yeah, it's an interesting story because when I first found out about SIBO, I had been in practice for already about 15 years. So I found out about SIBO in 2000, and I think it was 10 or 2011, where I went to a conference, the American Association of Naturopathic Physician Conference, and heard doctors Alison Seebecker and Sandberg Lewis talk about SIBO, and it was like a thunderbolt because it was sort of like the missing link that I found that many of my patients seem to have, where very well-intentioned protocols that we usually use for digestive disorders and dysbiosis and things like that, they were just not working for these patients. So it was really a sort of an aha moment for me, where I was like, wow, this is actually a really big deal, and it's going to be a really big deal for many, many people, because up to that point, IBS, as you may remember, there wasn't a whole lot out there for the treatment and even the diagnosis of IBS. And so what we now know is that a large percentage of these IBS cases are actually SIBO, and because it's a diagnosable condition with a breath test and a very treatable condition, all of a sudden we have all these good news really for IBS sufferers, that we're always told to just eat more fiber and learn to live with it.
Yeah, I mean, you're right about SIBO being a bigger deal than some practitioners, including myself. I mean, it probably was 2016 when I really started getting into SIBO, and was surprised to see that there were like weekend SIBO summits, and then eventually or week, what I guess was it summits and NUNM? I forgot. I don't know if they
Yes, those are the SIBO
guess,
summits.
Yeah, or I guess it's more of a conference, and then but anyway, since then, and again before then, there's been so many conferences and summits, and yeah, just a lot of information out there, just because it isn't easy to get rid of SIBO and to address SIBO.
Yeah.
And sometimes, as you know, you can't completely get rid of it. But can you talk a little bit about the different types of bacterial overgrowth? So what's like the difference between having an overgrowth in the small intestine compared to having large intestinal overgrowth?
So let's talk about first of what the normal physiology is. Maybe that's helpful for your listeners to kind of get sort of an idea of what's going wrong then with the normal physiology and the normal terrain of the digestive tract. So when you're eating, you're starting to secrete a lot of digestive juices that are meant to keep a lot of foodborne bacteria at bay and kill bacteria on contact. And so for that, because of that effect, there is a very low level of bacterial growth in the small intestine. The other reason is because it needs to be bacterial free, more or less, or very low bacterial levels in the small intestine, because that's where you break down your food and absorb your food. So too much bacteria in that area is not very helpful for absorption and so forth. So that's one thing, was where digestion is really impaired, for example, and you're not secreting enough digestive juices, and that can lead to local bacterial overgrowth in the small intestine. The large intestine is where you're meant to have a lot of bacteria, and something to the order of 3 billion per mil of stool. So there's a lot of bacterial activity in the large intestine. So we have these two places that are very, very different from each other. It's like the rainforest in the colon and like the desert in the small intestine. And when you have different reasons for SIBO, like I said, either digestive deficits or motility problems or structural issues, then you can end up with a local bacterial population. These are normal in small amounts, but when they overgrow, they cause a lot of problems. So, and we know about SIBOs, we know so much more about SIBO now than we did when we first started to learn about it. We're down to understanding what bacteria produces which gas, and treatments and so forth. So it's been a long road, but we're understanding a lot more now.
So when someone like a practitioner does a, let's say, comprehensive stool panel, and we see a lot of opportunistic bacteria, that is completely different than
Yeah.
SIBO. Like, you can't conclude that, well, if that person has a lot of opportunistic bacteria in the large intestine, so they might have SIBO. Really, the only way to know is by doing like a breath test, correct?
Yeah. So a stool test will really give you no information about the state of the small intestine in terms of bacterial overgrowth. It just simply is not equipped for that. So a lot of practitioners try to deduce that there is SIBO because potentially either E. coli or Klebsiella or Desalva vibrio are overgrown in the colon, which is not normal, but it's often the case, as we know. And those happen to also be bacteria that cause SIBO. But just because they're high on a stool test is in no way an implication that they're also high in the small intestine.
All right. Well, thanks for sharing that. And can you talk about some of the hidden causes of SIBO? I heard you talk about this. I think it was in your SIBO course, either your SIBO course or your
Mhm.
podcast. Again, I've been following you for quite some time. So if you could dive into that, that'd be
Yeah,
wonderful.
sure. Thanks. So, and that's where my sweet spot is really in terms of practice and also education, because I think we owe it to our patients to really find the underlying cause. Because I always tell people, look, the bacteria are actually not that hard to treat, but it is a very frequently relapsing condition, right? So, and we have to understand, why is it relapsing? And the causes of relapse are different for different people. So as I mentioned, the one, what I would say, category of issues is that you have a problem with digestion, or you have a problem with motility of the small intestine, or you have some structural issues like scar tissue from an abdominal surgery, or you have endometriosis, or anything that increases scar tissue formation in the abdominal cavity that then can disrupt the way the body moves food through the entire digestive tract, really. So if you think about the causes, then in those three categories, it gets a little easier. By far the biggest is the motility problem, right? And let's talk about that for a moment. The small intestine is equipped with something called the migrating motor complex, which is an actual part of the enteric nervous system that ends up sweeping the contents of the small intestine towards the colon. And the purpose of that is to keep bacterial count low. And lots of things can damage the migrating motor. Well, not lots, but different conditions can damage or hinder or impede the migrating motor complex. So that's one thing. Then the other aspect of dysmotility might be things like, or conditions like hypothyroidism, or issues with vagal tone, where we have vagal tone dysfunction with, extreme stress, or mold toxicity, or chronic viral infections that affect the vagal output. So under this umbrella of causes, you have 3 categories, and under each category, you have the actual problem, if you know what I mean. So it's a bit complex, and it's certainly not a one size fits all. But I think the more we understand about what caused SIBO for an individual patient, the more we can actually resolve this issue for them once and for all.
Yeah, so it's not as simple again of just following a low FODMAP diet or, a treatment such as antimicrobial herbs or rifaximin, because if
Hmm.
that's all you do, especially just a treatment, and we'll talk maybe a little bit about elemental diet. But again, either way, you want to always address the underlying cause, or as you mentioned, you could relapse and very well probably would relapse if you don't address the cause.
In many cases, that's what I see, and some people have relapse rates of every 2, 3 months, and some people have relapse rates of once every year or 2 years. So that also differs depending on what the cause is. And because the biggest issue is motility, that's where I often find the people that do the most relapse. But because when you have digestive issues, like let's say a typical case of digestive issues would be somebody who's had extreme stress for a few years, potentially due to their job or their relationship or whatever that may be, or trauma. We've all experienced different degrees of trauma, but it's just been really heightened. I don't know if you have experienced that as well, but a lot of people have like their whole baseline of anxiety is just way higher after COVID, seemingly, than it was before. So their stress can, this chronic stress can tell the body it's not time to digest anything. It's time to deal with the stressor. And so people just are walking around with chronic stress and then are not digesting their food properly. So that's the real thing. But that's relatively simple to correct because we have supplements and herbs that really aim to support digestive processes, like hydrochloric acid and bitters and enzymes and all of that. That's we know how to do that as practitioners. The motility stuff is, well, let me finish up with that other category, but just by saying the hardest thing about those cases is really inducing a parasympathetic nervous system response. And so I often refer to modalities like hypnotherapy and trauma work and different kinds of also vagal toning and brain retraining. And so that is a little bit more involved if it involves the central nervous system and the vagus system.
Just out of curiosity, have you noticed over the last few years, like an increased incidence of SIBO with all the stress that, post pandemic?
I definitely saw more relapses after COVID. So, and that I just sort of thought that was stress related. And I think just generally there's so many changes and worries that people are carrying these days. It wasn't just COVID and lockdowns and those kinds of things, but the just the state of the world is very frightening for a lot of people, and understandably so. So really learning how to down regulate or ground yourself and learn how to work with your nervous system is just one of the biggest skills that people can develop.
Yeah, definitely agree, and I'm glad you mentioned this because again, there are some people that just think it's all about diet and don't really
It's
relate
I'm so
stress
over that.
management with SIBO.
Yeah. Yeah, it's not like I'm over it, but I just find that stuff not difficult. Okay, occasionally I do have patients that fail treatment and they fail every single one of the treatments. And so, but those cases are I can count them on one hand that I've had in the last 15 years or so. So the majority of people will respond well to the treatment. It's about treating the cause of the problem.
So let's talk a little bit about the biphasic diet. But when I spoke with Siobhan again, we didn't really we spoke more about just low FODMAP diet, maybe Dr. Seebecker's SIBO specific diet. I forgot exactly what we chatted about, but we definitely didn't get into the biphasic diet. So I'd like for you if you could talk about why you created the biphasic diet, and I know you have a few different variations, such as like a histamine, one that relates to histamine, one that is a vegetarian version of the biphasic diet?
Yeah, so the biphasic diet came about because there were just too many instructions and too much confusion about low FODMAP, because I put people on low FODMAP and they would still be symptomatic. So hang on. Um, so I had to actually come up with a way to structure also my treatment, because I found that when a patient came to me, I would give them a breath test to take home, the first point of contact where we're just assessing whether or not it is SIBO. And I found that just supporting their digestion and putting them on a very restrictive diet, so this would be phase 1 of the biphasic diet, that's stricter than a low FODMAP, so it's virtually grain free and free of all the main allergens, dairy, gluten, and so forth. Egg is still allowed, but it's a very strict low FODMAP, but beyond that, and do a lot of supportive therapies during that phase. And then people would come back and they're like, "Oh my God, I already feel so much better." And then the test would come in, and we found that yes, indeed, it's SIBO. And then we could immediately move to phase 2, which is more the antimicrobial phase, where you're introducing again a few of the FODMAP foods, and you're really expanding on the diet also, so that you can have a little bit of bacterial growth, because you want them to be active when you're blasting them with antimicrobials. And I found this approach really helpful, especially for sensitive people that often have an issue with die-off, that familial condition where you're feeling the effects of bacterial death and absorption of the endotoxin LPS that triggers so much inflammation in the body. So when you already reduce their fuel source, you're already getting some bacterial downregulation. And so I found that approach really helpful. Now that has expanded. I just recently released an ebook that incorporates both the vegetarian and the regular SIBO biphasic diet. And the purpose of that was like, why are only vegetarians learning how to sprout their legumes and having all these other foods available to them, and not, because I'm a big fan of plant foods. I think plant foods is ultimately, as we know, from many different studies, whether it's the blue zones or the Mediterranean studies, that's really where we get our sort of fibers and nutrition from, that are really important for the microbiome in general. So anyways, it was a sort of a labor of love to put this ebook out that incorporated both the diets with lots of updates. So that's recently happened. The histamine diet I did with Heidi Turner, who's an excellent dietitian who works a lot with mast cell activation syndrome. And I found that often is a sort of comorbid condition in people that are really extremely sensitive and have SIBO and NCAS. And so we needed something for those patients, but also people that have histamine intolerance, which is actually quite common in people with SIBO or IBS. So that was sort of the history of the biphasic diet, really a structured approach that allowed me to have people do this in a stepwise fashion without having them leave with 10 different supplements on day 1. I really didn't want to do that. I wanted to kind of navigate it a little bit gentler.
So, and each phase is 4 to 6 weeks?
That's really adjustable by the practitioner. I've had people do just a 2-week phase 1. Depending on how they're responding, and then move straight to phase 2 when we're starting antimicrobials. But you can do it as long as you're improving in phase 1. So it starts with a very restrictive part, which is the restrictive phase 1, and then it's semi-restricted, which is a self-guided process. So as soon as people feel better, they can go to the second part of phase 1 and incorporate a little bit more rice and a few more vegetables and so forth. And then whenever you start antimicrobials, you do want to kind of move to the phase 2. But a lot of people find the biphasic diet really helpful when they have acute flare-ups, or they're, they have had sort of Christmas or one of those holidays that involves a lot of food, and they have a bit of symptom control to do. So they kind of just do a couple of weeks of biphasic or so. That's also a useful tool for that.
Okay. Yeah, the first phase kind of sounds like a combined paleo low FODMAP diet because she said eggs are
Yeah, it
allowed,
is.
but you're avoiding the
Yeah, and
grains.
specific carbohydrate diet. So it's sort of all of that because you're really reducing inflammation. You're wanting to start that process, or I find that really helpful when you focus on just supporting digestion and reducing inflammation before you go in there with sometimes kind of harsh herbal medicines. Also, some of these essential oils can be quite full on for people, but yeah, so that's been just super successful for me and for many of the practitioners that have completed the program and that are recommending the diet to their patients.
Okay. And then the second half is when you start the antimicrobials, and then it depends on how the person's responding. So someone might be on the antimicrobials for potentially a few months.
Yeah, so I would say each round is about 6 weeks, and if you have very high gas levels, you may have to do 2 rounds. So it's 3 months. In the second round, you might want to add in some biofilm if you retested after this first round and you've not made a significant progress. If you've made no progress, I would change antimicrobials. But so, it really is case by case. I'm always very hesitant to give sort of absolute numbers for how long you have to do it because it's really adjustable. Some people need more carbs, for example, from the get-go because they have blood sugar regulation issues. So that's also possible. And in the ebook, I mention all these different things that you can adjust and make it a little bit more manageable for yourself. Because I do have a self-help or a SIBO success plan, which is a self-guided SIBO treatment for patients, and I really walk them through the biphasic diet very meticulously.
And so there's also SIFO, small intestinal fungal overgrowth. Does the biphasic diet, would that benefit people with SIFO as well?
Yeah, so SIFO is also very common, very often comorbid or exists together with SIBO. And I find it has exactly the same symptoms, I'd say. So it is a diet that lends itself very, very well to the treatment of candida and other fungi. Um, the phase 2 of the biphasic diet, you can introduce honey and maple syrup, and I usually say don't do that yet if somebody has SIFO that I know has SIFO.
And I guess that's one reason you like also the herbs too, because the herbs can help with SIBO and SIFO, whereas the
Exactly.
rifaximin would just
Yeah.
rifaximin just pretty much is for SIBO.
Yeah. Yeah.
Yeah.
For mainly for hydrogen SIBO, right? Hydrogen sulfide. So it's limited even in, well, it's not, I mean, it's a good antibiotic and it's really specific to small intestinal problems. It doesn't get absorbed and it has a minimal impact on the large intestine unless you just repeatedly use it. So it's obviously a popular antibiotic for a reason. It works really well for hydrogen dominant SIBO. And it's still an antibiotic, and ultimately the problem with SIBO is that you have a dysbiotic microbiome of the small intestine because the bacteria that cause these problems are not pathogens per se, right? We know that where they're not the kind of pathogens that cause food poisoning, for example, like salmonella, campylobacter, E. coli. They hit the sort of food poisoning level of E. coli. You have normal amounts of E. coli in your gut that are important players of the microbiome, but when you have bacteria that are meant to be in small amounts, all of a sudden overgrow because of the reasons I mentioned before, then we run into issues. But they are normal players of the microbiome. So it's, for that reason that we really need to focus also on rebalancing a normal microbiome of the small intestine.
One question I have. So you mentioned that rifaximin mainly for hydrogen dominant SIBO, and then I learned years ago when I first started learning about SIBO that if someone has methane dominant, they could take rifaximin and like neomycin or metronidazole. Uh, can someone mix the antibiotics and herbs? Like, can they take,
Yes,
yeah, like Allicin with the rifaximin if
yes,
they have methane dominant?
absolutely. I actually prefer that. My usual routine with mixed SIBO, where you have hydrogen and methane dominance, if they opt for rifaximin, is to do that 2-week course, but to do more like a 6-week course of the Alimed or very high content allicin, not just the garlic extract, because they're not all made in the same way. Methane does take a little bit longer, and then maybe add in a biofilm buster and potentially also something like nystatin or maybe even oregano oil. So a little bit more involved, but you can absolutely mix and match.
Yeah, and with the biofilm busters, do you recommend it just for methane dominant SIBO or also hydrogen dominant?
I do it most never with just the first round. I don't. I want to see how they respond and what their relapse rate is. So I usually in those cases where they're relapsing right away, like within a few weeks or so, I will do it. I will add in whatever SIBO that is. If it's hydrogen dominant, I'll also add that in sometimes.
Okay, and what are your thoughts on the elemental diet? Is that something you sometimes recommend?
Yes, I do. It's a great tool. And what people don't realize is it is an actual antimicrobial. So don't be fooled by the word diet. It's not that you're adding this to your diet or you're doing this while you're doing other antimicrobials. It is a standalone antimicrobial treatment. And the idea here is that those ingredients are so pre-digested that they basically get absorbed as soon as they hit your small intestine when you drink it. It just gets absorbed really, really rapidly. And so there's no food left over for bacteria. And it is, when I first heard about it, I was quite skeptical. I was like, but it actually is quite dramatic of how the degree of reduction of gas. But the problem is, you got to do it for 2 weeks minimum. And a lot of people at that point are over the sweet taste, quite sweet. But there are different versions, and some people are great with it. And it is a great treatment, don't get me wrong. It's just that talking somebody into doing it sometimes repeatedly is hard.
Yeah, I guess it also depends on the severity of the SIBO and if the person has tried other things, like if they've taken
Right, right.
antimicrobials and it hasn't worked for any reason, and they
Yeah.
might, yeah. So,
Yeah,
but
and I often give the options. I'm like, here are all your options. Here's your conventional, recommendation. Here's what I would do, or here's the herbs I can give you, and here's the elemental diet, because these are the three options that we have. And so, and sometimes the second time around, people will opt for that if we saw minimal movement of the gas levels.
all right, now that makes sense. So bloating. So bloating is pretty common, gas bloating, and it could take time for the biphasic diet, the antimicrobials to kick in. So do you have any quick solutions? Like if someone's really, dealing with a lot of bloating, something they could do, sooner than later to get some relief?
Yeah, and again, there's like lots of different causes for bloating. Sometimes it is the gas of, obviously with SIBO, it's the gas that's produced by bacterial fermentation. There's no doubt about that. But sometimes it's not that. Sometimes it's the fact that you're just really deficient in, like I said, these digestive juices that help you break down food. And I see that a lot. I see a lot of people with suboptimal hydrochloric acid production, bile production or bile flow, pancreatic enzyme output, brush border enzyme output. There's all these different, um, you know, um, substances your body produces in response to food. And when they're really deficient, you're just not breaking down these bigger particles. And it's then you have all of this food actually arriving in the colon. And so colonic fermentation can also give this sensation of bloating. And then the treatment is maybe different, or it will be different than SIBO. And sometimes it's the neurological wiring that's basically in this fight or flight where nerves aren't really communicating very well. And things like hypnotherapy, we know from research, in certain cases can dramatically improve symptomatic relief for IBS sufferers. That was just a mind blower for me when I looked at these studies with hypnotherapy or gut-centered hypnotherapy and IBS, symptom scores. It was just amazing. So if that's the case, then I would really recommend doing things like working on that vagal toning and nervous system down regulation. If it's digestive stuff, then I would start with something like a bitter tonic to help with the production of these digestive juices. And if it's just like, okay, you're bloated and you're going to a wedding and you got to fit in a tight dress situation, then I'd probably use something like a charcoal binder, or a different type of charcoal is pretty good because it's just simple, it's easy to get, and it does tend to bind gas. Or also doing certain exercises like the wind relieving exercise, yoga poses, and things like that.
All right, thank you for that. And
Oh, and I have
you
a
met,
carminative tea. Actually, I forgot about that. This was a video I created about how to make your own carminative tea. And carminative is a word that we use in herbal medicine that means wind relieving, so actually reducing gas. And it's 3 seeds. It's caraway seed, anise seed, and fennel seed. And you mix them in equal portions. You put them in a jar. You take 1 teaspoon, put it in a mortar and pestle. You grind it up a little bit, bruise them, and then you put them in a cup and you put hot water on it, steep it for 5-10 minutes, and you drink that after a meal. So that's an easy thing to do if you go to like a bulk seed store or so. I don't know, maybe you can just buy them, I guess, but we have like bulk stores here where I can get my flour and different seeds and different spices and herbs, and put them, little paper bags, take them home. It's easy. And you mix them up and you make yourself a cup of tea.
and just I guess one cup. Start with 1 cup, but will some people need like multiple, like to
So
drink like 2
yeah,
or
I
3
would
cups?
say
Or
you can even brew it right properly for like 10 minutes in a teapot, and then you make yourself a big teapot and you drink 1 cup after each meal. It doesn't have to be hot. You can just drink it cool as well, and it's pretty pleasant tasting. And it can really help with the reduction of bloating.
And you mentioned bitter herbs. Would something like apple cider vinegar work too to stimulate the body's own production of stomach
Yeah,
acid?
so actually, yeah, so when I think about different degrees of increasing stomach acid, and well, let me just back up. So your normal stomach pH when you're at normal sort of resting state is supposed to be the acidity of carbonate acid, which is around 1 on the pH scale. Which, if I were to stick my finger into your stomach, it should get digested all the way down to the bone, right? It should get broken down, and that's a normal, healthy stomach acid output. When it goes down, now all of a sudden, if you're not putting out enough, your pH starts to go up, meaning more alkaline, right? So we have certain things like lemon juice and apple cider vinegar to help with the pH of that, but it doesn't do much to stimulate your own parietal cells of the stomach to produce hydrochloric acid. Herbs like gentian and all the bitter stuff, dandelion leaf, and I use a lot of berberine as well, like Oregon grape, because it's a great bitter, but it's also a mucosal tonifier, and it does have some obviously antimicrobial activity. So I would use that because it directly stimulates the parietal cells to increase their stomach acid output. So there's a various degrees, and then the next level from there would be actual hydrochloric acid supplementation. So it's different things do different stuff. And apple cider vinegar, while it's fantastic for some people, it really helps with improving the stomach feel. Some people are sensitive to the histamine levels of all fermented foods.
Yeah, that's a good point. And thank you for explaining the differences. I don't realize, I know berberine obviously used as a treatment, especially for hydrogen dominant SIBO, and has benefits for the gut microbiome. But so you mentioned it also stimulates the body's own production of stomach acid as well.
Yes. So berberine is actually the ingredient or the constituent, as we call it in herbal medicine, that is present in many different plants, right? So there's a berberine containing plant family, and some of them are big trees like philodendron, and some of them are brushes like the Oregon grape root is basically a bush. And so different plants, but they can be extracted, and berberine then is the active ingredient that has these antimicrobial activity. But if you use the whole plant like Oregon grape, which has been traditionally used for as a bitter, as a stimulant, but also as a mucosal tonifier, you get all this added benefit, of having good effects on digestion in general.
All right. I have a couple of quick true false questions for you. So, and you could feel free
Okay.
to expand on this, but, I don't think you mentioned, or maybe I mentioned in the bio, but I'm not sure if that people know that you're in Australia. So this question might differ based on the location. I'm not sure, but so true or false, most gastroenterologists, most GI doctors are familiar with SIBO.
Oh, I think that's false, or they often dismiss it. You know, um, ah, it's a tough one because I see pretty extreme cases, and so they have gone to different gastroenterologists, and some do the breath test. But I think that adage of that any new discovery in medicine takes at least 20 to 30 years to filter down into the actual offices of medical doctors. So it takes a long time. And we're only 15 years in or so at this point. And it's starting to happen with regular, a lot of functional doctors are familiar with it at this point. Some medical doctors, some gastroenterologists. We have some absolute superstars, obviously. Gastroenterologists like Lenny Weinstock, and then there's also Dr. Bolsevich, who wrote Fiber Fueled, who's a gastroenterologist who is more into microbiome restoration rather than SIBO, but at least the awareness of microbial issues like the microbiome are starting to really I think take foot. So or take hold, I should say, in some of these modern or conventional minds. But it's still oftentimes I see patients that say, I was told this is not my problem, and then we do a breath test, and lo and behold, it's the problem. And when we treat it, their problems go away. So yeah, some people are very upset by that because they should have been told that it is a thing.
Yeah. Yeah, I
Sorry,
agree.
that was not a true or false question. That was a very long-winded answer to a short question.
Yeah, well, I expected you to expand and not just say false, but I brought it up just because some people might go to the GI doctor hearing SIBO, and then the doctor might dismiss it and say, no, that you don't have SIBO, but they didn't do a breath test. Maybe they did an endoscopy, or maybe they
Yeah.
didn't do anything. They just,
Yes.
dismissed it because they're not familiar with it. So,
Mm.
so yeah, thanks for that response. And then true or false, it's okay to just randomly treat someone with SIBO rather than do testing.
100% false. Well, okay, nothing is ever 100%, but here's my pitch for testing is, first of all, you need to know that it's SIBO. Now that you know you have these three different categories of causes, it's important to know if it's actually SIBO so that you can then explore the reason why SIBO is there to begin with. Second reason is you need to know which gases are dominant so that you know what you're actually treating, because the treatment is different it varies with different gas types. So those are my two main arguments for testing, and testing is super accessible. It can be done at home. It's available on all major continents, and it's do at home test. It couldn't be easier.
And now that they do offer some testing for hydrogen sulfide, would you say that like a person might not need that if they're not like if someone's experiencing more constipation, would it be okay to just do the traditional SIBO testing? That
Absolutely. Yeah. Yeah. So, unfortunately, there's only one lab right now in the world that does hydrogen sulfide testing. And that's always a bit limiting in all ways. And also, I'd like to have more labs that then corroborate the fact that this is a valid test. And I'm not saying the test is not good, but I would just say that not everyone needs this particular test that checks for hydrogen sulfide, simply because what we can expect in terms of symptom wise for hydrogen sulfide is a diarrhea dominant type of SIBO. So somebody that's constipated may have hydrogen sulfide production in the colon because it causes constipation when sulfur, they're called sulfur reducing bacteria, which is very confusing. They're not reducing, they're just biochemically reducing sulfur. When they're present and overgrown, they can cause constipation in the colon. But a breath test for hydrogen sulfide will not pick up that level, right? So, or very rarely. So it's really the cases that are not positive, or maybe not, barely positive on a normal lactulose breath test, though, and they have diarrhea. I would then suspect, and maybe also some other symptoms that maybe gives you a suspicion of hydrogen sulfide, like sulfur sensitivity, burning type symptoms, that kind of stuff.
Yeah, I brought it up just because I mean I kind of expected you to say that, and just wanted others to hear, just because I've had a few people bring up the test, and just because it sounds great. Now you have the new test that tests for 3 different types of SIBO, and I've also mentioned where not everybody needs to do that test. So I
No.
just wanted to hear it from the expert, someone who's dealing with SIBO on a day in, day out basis. So thank you for
Mhm.
sharing that. And I got one more true or false question. I know the answer to this, but
Okay.
again, just it's another area of controversy, and it doesn't specifically have to do with SIBO, but it does have to do with the gut. So true or false, everyone should be treated for parasites.
No, that's false. First of all, there's some interesting research about like the two most common things. You probably agree with me are D. fragilis and blastocystis, right? We see them not too infrequent on stool tests. And what we now know about blastocystis, for example, which is a protozoan, it's actually not, depending on what subtype you have, it's actually associated with a healthy microbiome. So, certain subtypes can be a great benefit to have on board. I have blastocystis. I don't have any symptoms, right? So this kind of over focus of that the bug is the cause of all your problems is what it's a very sort of reductionistic and conventional approach. Oh, it's the bug that's the cause of all of this issue. It's really not. It's the terrain. I'm not saying that nobody has parasitic issues, but I think it's been popularized by sort of the online wellness industry to some extent. Because I do a lot of testing, I don't see parasites too often, and when I see blastocystis, I'm like, okay, let's see what else is there. Really learning how to interpret a different, not just a stool test, but like a shotgun genomics test, which is really a true measure of the microbiome. That's where it becomes much more interesting and takes a bit more finesse and understanding of the microbiome.
All right. Yeah. I asked you this just because I saw you, I heard you say this on one of your courses, about the parasite. So I knew the answer was going to be no, but there are some practitioners, some who I've interviewed, quite frankly, for this podcast. And I don't treat everybody for parasites either. But, I like to get different perspectives, because someone might hear a podcast episode where I interview
Mhm.
someone and they say, yes, everybody definitely needs to be treated for parasites. And, again, like I said, just nice to have
That's
different
just a
perspectives.
foreign concept for me because, if you think about it, and well, first of all, it's interesting. There are lots of studies that show where the studies I'm thinking of is where African immigrants came to America, and adopt, basically started a standard American diet. And they, I think they did, like, I can't remember now. It's been a while since I read that study. But what stood out to me is that when they started having digestive symptoms and they went to the doctor, they did typically the fecal multiplex PCR that looks for, the parasites and the food poisoning bacteria. And they had parasites. They were given antibiotics, and everything went to hell in these people. We have sort of some of the parasites are actually ancient organisms that have co-evolved with us. And the problem is that the terrain of the gut has been so mismanaged, or is so in such poor shape, with such low microbial diversity, for example, and overproduction of different toxic metabolites, that it's just the environment that leads to the growth of some parasites. I'm certainly not trying to make a blanket statement for all parasites, but it's more the thought process that leads to, why do we need to find the one bug that's causing this and all the problems are over? I just don't subscribe to that idea.
Yeah, I agree, and I appreciate you taking a few minutes to address the true or false question. So thank you for that, Nirala. And anything else? I know there's so much we could cover, but anything that we didn't cover that you really wanted to bring up, or any like last words that you wanted to mention before before you tell everybody where they could find you?
Well, I think you did a pretty good job with the question. So, and especially if they have other episodes of your podcast that goes into more symptoms and what causes. But I would invite people to that have SIBO, that are struggling with SIBO, to really start focusing on finding the underlying cause. There's a free handout that they can get from the SIBOdoctor.com that's just about, what caused my SIBO. It's a very rudimentary questionnaire that you can complete, that you can give to your practitioner, and they can at least get some idea as to what the problem might be, because that's really where true healing is. It's not about always just chasing bacteria. That being said, some people that have a damaged enteric nervous system or migrating motor complex, they may need repeated doses of antimicrobials, but at least you know then what the problem is and you can address it correctly.
Yeah, definitely check out our website, check out our podcast, amazing podcast, and her courses. I've taken a few of her courses, including the histamine masterclass with Heidi Turner. That was a real good class as well. And also you're in practice too, the biomeclinic.com. So you're still seeing SIBO patients day in, day out.
Yes, I will say that I am planning on going on a sabbatical at the end of this year. So that's been a recent decision I've made. I've been in practice for a long time, and I just need to take some time off to rejuvenate my enthusiasm for for everything, and also really focus on other courses that I want to bring and update I'm in the process of updating the SIBO Mastery course for practitioners. And so I still have a lot of juice for the topic, but because I have like four different businesses and different things that I have my fingers in. So I just need to downsize a little and just not see patients, because patients, as you know, are often complicated and time consuming, and it's wonderful. It's very rewarding, but I've decided to just take a little bit of a break. But so people can find me on the SIBOdoctor.com. That's where a lot of the courses are, the free resource. The Biphasic diet ebook now has a charge to it because it's expanded and I've put a lot of effort into it. And so that's available. And there's some other free resources that you can find, and also the SIBO Success Plan, which is a course for patients that's put a lot of energy into that, so that people really get a good education about what's a lot of expanding on a lot of things we talked about here today.
All right. Of course, I'll make sure to include those links in the show notes. And thank you so much, Nirala, for sharing your knowledge with regards to SIBO, the biphasic diet, putting up with my true and false questions. I appreciate your time. And again, I as usual, I always learn a lot from, chatting with people here, and definitely learned a lot from our conversation here.
Thanks for the invite, Eric.